The medial and lateral menisci function to improve the stability of the knee, increase shock absorption, and distribute weight over a larger surface area.
While working, UPS delivery man Tera twists his knee while his foot was planted, resulting in a tear of the medial meniscus.
To repair the patient's bucket-handle tear of the meniscus, the patient will undergo surgery. The procedure is called autoglottis chondrocyte implantation. It consists of two parts. Part 1 of the procedure involves going arthroscopically into the knee. Next, the surgeon will take a piece or two of articular cartilage. The one or two pieces will be dissected so we only have chondrocytes. The reason for only wanting chondrocytes is because these parts produce cartilage. This process of reproducing chondrocyte takes around 6 to 8 weeks. The final surgery is taking a group of chondrocytes and sewing them over their articular cartilage defect. The remaining chondrocytes are injected underneath the patch that was formed. This will now cause the chondrocytes to form into something like hyaline cartilage. This will help make the joint function as it normally would.
Prism is applied to help manage post-surgery signs and symptoms.
The patient after this surgery is unable to weight bear for up to 8 weeks. To get around, the patient will be placed on crutches with a knee bent at 30 degrees and a knee immobilizer.
To help restore full knee extension, the patient is put in the long sitting position with the foot dorsiflexed. The patient contracts the quads isometrically, causing the patella to glide proximally. This is held for a moment and then relaxed. The patient can also place a rolled up towel under the ankle to further exaggerate knee extension. To help increase knee flexion, the patient, with the help of a towel, pulls their knee into as much flexion without pain as possible. To progress this, the patient can perform towel slides. The patient slides their heel towards their body by flexing their knee. This is also a good strength transition range of motion exercise because it is activating the hamstrings. In the early stages, when the patient is focused on restoring full range of motion, cardio can be kept up by using upper body ergometer. To start strengthening the hamstrings, the patient performs open kinetic chain hamstring curls. The patient is prone and flexes the knee, bringing their heel to their butt, and extends the knee back down to the table. The patient focuses on a slow, controlled speed. To progress this exercise, we can add resistance with different pound ankle cuffs. To strengthen the quadriceps, the patient can perform straight leg raises. With the knee extended, the patient isometrically contracts the quads and flexes the hip to roughly 45 degrees. To stabilize the pelvis and low back, the opposite hip and knee are flexed, and the foot is planted flat on the table. To progress this, ankle cuffs can be added. With strength gains in the early stages, we can continue to focus on full range of motion by putting the patient on the bike. This is slow and controlled, with the patient focusing on full knee extension. A strength exercise to help the patient with the transition from crutching to walking are step-ups. For knee stability, as well as strengthening of leg muscles, a proprioceptive balancing exercise can be performed. We do this on a hard surface or a soft surface, eyes closed or eyes open. To progress step-ups, we can create a higher step. There are different balancing exercises for increasing stability, strength, and confidence in the patient, such as the cup pickup. Before the patient can progress to unassisted closed kinetic chain exercises, he first must use the wall to perform 45-degree squats, and then progress to 90-degree squats on the wall. After this is easy, the patient can then progress to bodyweight squats at 45 degrees.
The next progression in the rehab includes squats and lunges. As Tera steps forward, he dips down into the lunge position and then follows through by standing up and alternating each leg as he continues to walk. This then progresses to bodyweight squats, where Tera stands in an athletic position as he dips down into the squat position. After he dips down, he follows that by standing up and repeating the process for strength gain in his quadriceps and hamstrings. This also helps improve his posture.
After performing lunges and body weight squats, the patient can now perform plyometric exercises. Plyometric exercises are explosive in nature. A great endurance exercise that doesn't require pounding on the knees is the bike. This can be used to keep the patient in shape throughout rehab.
The final set of exercises were used to functionally test the patient and see if he would be able to return to work. These exercises included lifting boxes, moving them to different places, stepping over things to deliver boxes, and placing them on the ground and carrying them up the stairs. If the patient is able to perform these exercises without any difficulty, then he will be able to return to work.
We also want to make sure the patient is confident to return to work.